Hey guys, let's today talk about discharge teaching after a patient has surgery. So, discharge teaching is super important as it promotes the safety of a patient by decreasing complications and hence promoting their healing. So, teaching is often going to be specific to the orders of the provider, which would be procedure specific, but we also have to take into account other teaching points like issues concerning anesthesia and medications. Guys, discharge teaching and planning should actually begin way before the patient arrives in the post anesthesia care unit or PACU. Be sure to check out our lesson on preoperative assessment and education for more information. And guys, we also want to involve the family or caretaker in this process if the patient permits, as they often provide support and understanding to the patient. So, with discharge teaching after surgery, it's going to be very important to assess the patient's learning needs. Obviously, this can vary greatly depending on the patient's age and cognitive and education level. And also, guys, are they ready to learn? Remember, your patient just received anesthesia, which means they may be a little bit out of it. And are they able to focus? Remember, people that are in pain have a difficult time with this. Also, after you have taught your patient, you need to make sure they actually comprehend what you said. Okay, let's look at some important things that we need to teach our surgical patients at discharge. We want to make sure we teach our patient common side effects of anesthesia like drowsiness and dizziness. And guys, it's super important that we stress no driving and no alcohol for 24 hours after anesthesia. And the patient really should have a caretaker for a day after. Make sure you check out the additional lesson on general anesthesia and also moderate sedation for more information. Teaching specific to the surgery is also important, like when to change and remove dressings, when to shower or bathe, and any restrictions to exercise. Medications is another important discharge topic as patients typically are prescribed new medications to take home. Explaining these and also providing the patient the time of the last dose that maybe they were given while in PACU is critical. Also, guys, if the patient isn't prescribed any pain medications, we talk to them about the use of acetaminophen and NSAIDs as long as they aren't contraindicated. And we also stress the importance of not taking acetaminophen if other medications already include it. It is extremely rare to have a patient who isn't on some type of medication preoperatively. So, with this in mind, we want to review with them when to resume home medications. This is super important. Diet is also a big deal, as remember, your patient just had surgery. So, reviewing the diet instructions provided by the surgeon is very critical, and make sure that your patient actually understands. Okay, so we all know surgical site infections are a huge concern after surgery. So, with this said, we need to teach our patients any signs of this, including fever greater than 101 Fahrenheit, a warm red incision with any pus or discharge, also worsening pain that can't be relieved with medications, and nausea and vomiting that is persistent. And we say persistent, guys, because occasionally patients will experience nausea and vomiting after discharge because of the anesthesia. So we also teach our patients that certain things like pain can be expected for a certain amount of time because remember, they did just have surgery. Be sure to check out intraoperative and postoperative complications for more information. Okay, so we need to make sure our patient understands who to call if they have any questions or concerns, and also provide them with that contact information. We also want to teach the importance of patient support by family or a caretaker and involve them as much as possible because patients often need assistance after surgery. Guys, finally, we need to teach the patient when to follow up with the surgeon, including providing the appointment or when they should call to schedule one. Okay, guys, here are some nursing concepts besides the obvious of patient education. As PACU nurses, we provide patient-centered care, meaning we always take into consideration the patient's specific needs and desired outcomes when teaching at discharge, which keeps the patient safe with prevention of infection as one of our main goals. Okay, let's look at some key points. Discharge teaching after surgery is patient-centered and it promotes safety to decrease complications and promote healing. It is good to involve the family if possible. We need to assess the patient for readiness, learning needs, and understanding after instructions are given. We teach surgery-specific instructions like dressing changes, drain care, when to shower, and restrictions. Also, the patient should report fever, pus, redness, and warmth at the incision site, and persistent nausea and vomiting. The patient should be taught that anesthesia can cause dizziness and drowsiness after surgery, and the patient should not drive or drink alcohol for 24 hours after anesthesia. Finally, the patient should be taught about new medications, including pain meds, when to resume home meds, and when to follow up with the provider. Okay, guys, I hope that you enjoyed this lesson on discharge teaching after surgery. Make sure you check out all of the resources attached to this lesson as well as the rest of the lessons in this course. Now go out and be your best self today. And as always, happy nursing.